And for today's topic, I want to review a video that was shot about 1.5 years ago with myself and Dr. Andre Dokukin, where we filmed from start to finish the very first session of TMS known as the mapping. Now, in that video, there's a few things that I want to go over in detail about some of these sensations and expectations that you might have during your first TMS treatment. Without further ado, let's get to it. Okay, so this is the part where I think there were some questions, especially for people that are actually engaging in treatment. At this point in the video, we have found the treatment location, all right? The left dorsolateral prefrontal cortex. That's usually what we use for depression. And on the right is the right dorsolateral prefrontal cortex, which is usually used for treating anxiety, all right? So in finding the left dorsolateral prefrontal cortex, in finding the treatment location, you usually find something called a resting motor threshold. We'll just call it the power level for simplicity, okay? And we'll just throw out a number. Let's just say 50, all right? 50 power level. What we do is when you move the coil to the treatment location, we usually want to take a percentage of that power level to administer treatment. So if you have a resting motor threshold of, let's say, 50, you'll usually start off at that treatment location at around 80% of that 50. And over time, as your scalp gets used to the treatment, you bump it up to 90, bump it up to 100, 110, and then the target, ideally, would be about a 120% of that resting motor threshold, okay? Just for clarification purposes, 100% is reasonable, totally reasonable. 110% is better. So you don't necessarily need to be at 120%, okay? Because as you amp up or ramp up to a higher percentage, it can get more intense, can get more uncomfortable. So if you're able to tolerate 120%, that's great. If you can only tolerate 110, that's fine. And 100% is where I would say that's about the minimum that you would want for somebody to be able to get effective TMS treatment. Okay, so if you look at where the coil is placed, which is usually about right here, it's actually usually where the side hairline meets the top of the hairline, right there in the corner somewhere in that vicinity. There's facial muscles, there's facial nerves that are running throughout that area that are going to get stimulated along with the stimulation of the brain, which is more internal. Okay, so there are things or sensations that you'll feel along with the pulses that come from the coil. Jaw movement, perfectly normal. Eye twitching, perfectly normal. Eyes watering, perfectly normal. And that's just based on the anatomy. Some people experience the jaw movement, some people don't. So I'm trying to zoom in here so you can actually see the jaw movement. It's really fine, so you might not be able to see it, but my jaw is moving. There is some chattering there. And for people that do get the jaw movement after the session is done, it's really not much of a problem at all. I maybe had one person who experienced some jaw fatigue later on in the day. And what we did for future sessions, we just went down from 120% to I think like 110%. And that was fine. There were no issues after that. So, and that's happened maybe once. So there's 3 types of sensation that people usually experience when they're doing TMS. One is a dull sensation. I'd say like a jackhammer effect that I actually got during this video. From the TMS coil. The second one is more like a woodpecker effect, which I'd say is more frequent, where there's a sharp sort of poking at the scalp. And then there's another one where there's sort of a sharp sort of pull at the scalp there. All 3 of those, as I describe them, sound very unpleasant. And I wouldn't say that it's a comfortable feeling, but I would say that it's very tolerable. And over time, your scalp actually gets used to the sensation to where you feel it, but you kind of forget that it's there. I've had plenty of people watching TV while doing TMS. I've had people read books while doing TMS. I've had people fall asleep in the chair while doing TMS. So again, the description of a jackhammer, woodpecker, and sort of the pulling effect, again, it sounds unpleasant, but again, people get used to that sensation actually. Okay, so as unpleasant as the description may be, the sensation itself, once you're actually in the chair, is actually quite tolerable. Okay, so the one sensation that I tend to be on the lookout for, especially when initiating TMS treatment, is in the teeth. Okay, remember, there's nerves running all throughout your face. There's nerves running into the teeth, the dental area. And sometimes when initiating TMS, you'll get a dull sensation. And that one I'm honestly not too worried about. You know, again, as long as it's tolerable for the patient, not much of an issue. But usually when there's a sharp sensation that's traveling into the teeth, I readily make adjustments for that. So if you're experiencing more of a sharp sensation in the teeth, especially the top row, I would let your doctor or your tech know so that they can make some adjustments with the placement of the coil. And a lot of times I'll move it a little bit anterior and it comes off the nerve and treatment carries on just fine.